Another quick assessment tool you can use for strokes is called a FAST exam, or also known as a B.E.F.A.S.T. So let's cover what those mean. B is for balance, so you're looking for an unsteady gait, if they're walking, if they're leaning to one side, if they can't ambulate at all. I also take their word for it. Family members will be like, they're just not walking normally, or the patient says, I feel like I can walk, but it just doesn't feel right. They know their body better than we do, so I take their word for it as well. E is for eyes. So for this one, you're looking for vision changes or vision loss. This one can present differently. I've had a patient come in through triage who actually presented like a detached retina, where they were describing their vision being cut in half, like a curtain being pulled over. But then they started to describe it a little more, and they said it was more like a portal. So basically, would stand in front of them, and if I moved to one side, I would just disappear in their vision. And they ended up having a little stroke. F is for face. So for this one, we're looking for a facial droop. So what I like to have them do is have them smile, and I'm just looking to see if one side of their mouth drops lower. You can also see it in their eyes a little bit if it drops down. Some other things they'll test is see if you can lift your eyebrows or wrinkle your forehead. This is just to help differentiate between a stroke or is this possibly Bell's palsy. A is for arms. So for this one, we're going to have them close their eyes, lift their arms up, see if they can hold them out. And we're looking to see if, one slowly drifts down or if it just rapidly falls. I also like to add in legs here. I know it's A for arms, but I do all four extremities to look for any drifting or a complete drop. S is for speech. So for this one, we're looking to see if you have slurred speech or incomprehensible speech. We'll even grab random objects, like I'll just grab my glasses here and be like, can you say what this is? And sometimes they'll be able to say it, or sometimes they'll say the wrong word, or they won't be able to speak at all. These are all symptoms of a possible stroke. Some common things we test for are diabetic issues like hypoglycemia and alcohol use, because they can also present like that with the slurred speech. It can be a little confusing, so we help differentiate by testing an alcohol level and your blood sugar when you arrive. The last one is going to be T for time. This isn't an actual physical symptom, but it is just as important. We need to know when these symptoms started and how long they've been going. So some people will wake up after going to bed normal and have stroke symptoms. Some people might wait longer because they think it's something else, and they'll be outside of this time frame. A full stroke activation at my hospital, at least, is within the last 4 hours you were seen normal of having these symptoms. And we're going to see if you're a candidate for alteplase, is what we used to use. Now we use tenecteplase, but it's a clot buster medication, and it's very high risk. But first we have to differentiate between if you're having a hemorrhagic stroke, which is like bleeding in the brain, or an ischemic stroke, where if you have a clot in there that we can go in and break up. But it is very important to know the time frame in which these symptoms started and how long they've been going on. So there you go. That was a quick little overview of the B.E.F.A.S.T for a stroke assessment tool for healthcare providers. Hopefully that was a little helpful or refresher, and for people who might not be in healthcare, and now you're just more informed in what to look for if you're suspecting a stroke in a family, loved one, or yourself.